You're listening to the Martin Clinic Wellness Podcast. This is the show where we bring you the best tips, tricks, and nutritional hacks to help you and your family get healthier. You will also hear what works and doesn't work, so you don't have to waste your time and money. All right, let's get started. Hello, my name is Dr. Tony Martin Jr. of the Martin Clinic, and I'm here with my dad, Dr. Tony Martin Sr., also of the Martin Clinic. And today we want to talk about, really something that is becoming an epidemic today. It's kind of, it's one of those things that we really not getting talked about a lot. We talk a lot in society today about obesity and how, 1 and 2 basically are, either obese or on their way to obesity. I mean, we talk about diabetes, how 1 and 2 are pre-diabetic, and, the statistics are crazy. Yeah. But on the flip side, one of the effects that we're seeing a lot today, which actually has a tremendous impact on aging and early death, is the flip side of that, which is something that we're seeing as all the time, is a combination of obesity and sarcopenia, which is muscle loss. Yeah. So now we're seeing a lot of obese people, and they've got no muscle mass. And we're going to talk about today's episode. We're going to talk about protein. And we're going to talk about the role that protein plays as we age. And we're also going to talk about we're going to talk about aging and how to age properly, and how protein fits into that. And the question we're going to ask right off the bat is how much protein you should be eating. And that's what we're going to talk about. But also we're going to talk about the why sarcopenia matters. Yeah. Right. It's something that we see, like I said, it's become an epidemic. Yeah. So people are
men and women,
right? Yeah. Men and women, sarcopenia is one of the beginnings of the end for people. When they get sarcopenia, we'll talk about this. It usually signals the beginning of the end.
Yeah, and a lot of skinny people are not healthy because they have sarcopenia.
Exactly, no muscle mass.
Muscle mass, yeah.
So let's talk about that, because it's an interesting topic. Because one of the questions we get asked a lot is, well, how much where does protein fit into all this?
Because when you think of muscle, and most people would relate to that, is that they think of muscle, what builds muscle is protein, right? So the question is, like you say, how much protein do I really need? Because the thing that you can affect is how much, what you put in your mouth every day. Is it going to have an effect? It's going to have a huge effect.
And we're going to find out quickly as we talk about a couple of studies that it actually gets more important as we age. You need more protein as we age. So we're going to talk about that first of all. Now, first of all, a study came out showing that the average senior eats less than 60 grams of protein a day, because it's only normal. They just eat less food as they age. Especially as they get over that certain age, they just start to eat less food, and they're finding that they're eating like 60 grams a day of protein, which is sarcopenia. I mean, that's how you get sarcopenia. That's a recipe for disaster right there.
Yeah.
And,
and they're eating way too many carbohydrates, right? I mean, if they do eat, they're eating carbs because it's easy. Yeah, a lot of them just don't chew properly, and you know what I mean?
So it becomes difficult to get protein.
Yeah, like they're not thinking, like I can think of my grandmother there, and she loved steak, but when I think of how much she used to eat, like a bird would eat that, right? Could live
so so that's why they're only getting 60 grams a day. We're going to find out they need a lot more than that, especially when we'll look at some of the studies, and this is fascinating stuff. And if you're concerned at all about aging and aging well and living a little longer, then this stuff matters big time. Yep, this is very important stuff. Now, first of all, it's really interesting when we talk about aging. Everybody's like, aging, and we're getting older. Well, what's the definition of aging? Well, I'm getting older, right? Well, that's how people would think about it. But let's talk about aging and what a good medical definition of aging is. So I'm just going to read you a little bit here about a good medical definition. And basically, it's classified as what they would say is the widespread reduction in the reserve capacity of the body's major organs. That's the medical definition of aging. So basically, the capacity, or you get a reduction in the capacity of these organs. Now, specifically, what they're talking about is a decreased cardiac output, right? So our cardiovascular system output decreases. Yeah. Our lung function decreases.
Yep.
our skeletal muscle oxidative capacity decreases, so our muscles become less effective, decreases, and our body composition changes for the negative, meaning that we start to store fat in a whole bunch of different places, and that also changes the way things work as well. And what's really interesting is that all that leads to a decrease in something called VO2 max, which again is we'll talk about that in a little bit. But then what they find, this is fascinating, is that all these things, researchers tell us, leads to an inappropriate fat deposits everywhere, which then leads to systemic age-related insulin resistance. Our organs become insulin resistant. We become insulin resistant. So all those things that we mentioned, like as we age, our cardiac input goes down, our muscles don't work as well, our lung function goes down, our body composition changes, and all that leads to systemic insulin resistance. And then we've talked about this in previous episodes before about how the brain can become insulin resistant, and that leads to dementia and Alzheimer's, right? The pancreas, liver, all these things, the way they metabolize insulin changes, and that leads to aging and death.
Yeah.
So as we age, we become insulin resistant. Our body wants to become insulin resistant as we age. So we have to, anti-aging medicine really should be fighting or slowing down the effects of insulin resistance. And unfortunately, the way we eat today, people are becoming insulin resistant in their teens and 20s and 30s. Long before, so they're aging so much faster.
Yeah,
they prematurely age, right? So that's what's going on there. So one of the big factors in aging, bigger than most people know, and we're going to talk about a study coming up in a second, has to do with the health of our muscles. If your muscles aren't healthy, you're aging faster. You're going to die quicker, and we'll talk about that study in a second.
Yeah, and can you? I can't help myself. When you take a statin drug, you're damaging your muscles. Well, what is your heart? It's a muscle.
Oh, and
you're killing yourself. It drives me crazy.
Our next episode, we're going to talk a little bit about cholesterol.
I get ahead of myself,
but we're going to talk about it on our next episode. But yes, you're right. It's the great con, right? Yeah. It is the great con, and it brings up as a whole other Alice in Wonderland hole that we can go down to for a second there. But you're right. So muscle mass matters. Mm-hmm. So you have to look at muscle mass as we age. So that's a big thing there. So now, what is also interesting, research is showing that as our muscles deteriorate, there is a direct correlation between muscle loss and bone loss. So somebody who is sarcopenia, or they're losing muscle, their bones are also deteriorating as well.
Yeah, and one of the fallacies of that, and we see it every day again in the office, is that people, well, I'm worried about my bone quality, I'm going to get, I got osteopenia or whatever, and especially women. Men usually don't worry about it. They should.
They should, because that's a big issue with them as well.
They should. But they got it I'm just going to take a little bit of calcium here, and that's sort of going to solve all my problems. And we find out that, we're going to talk about this, because once we realize it's not calcium. If you can strengthen your muscle,
yes,
you're going to strengthen your bone.
And that's the thing that really bugs us, is that if somebody goes to their doctor and they've got low bone quality, they're going to tell them, well, take some calcium and take this drug.
Yeah, take Fosamax.
When they should be telling them, let's increase that muscle mass. Let's increase the rate at which muscle is deteriorating. Let's strengthen that up. Let's get some more protein. But we'll talk about that at the end. But you're bang on. That's exactly... Yeah. They're looking at the bones in a vacuum. Like the bones are their own little system, and they don't rely on anything else. And so, take calcium for bones, you're going to have a healthy, and we know that's we did a podcast, go back and listen to a podcast on the joke or the fallacy of calcium. We've talked about that. Yeah. But it is such a short-sighted view on how bones actually work. And the reality is that healthy bones means healthy muscles. If you don't have healthy muscles, you don't have healthy bones.
Yeah.
And that's the fact of it. So that's what we're gonna talk about. Now let's just talk about a little bit about why sarcopenia, and then osteopenia, loss of bone mass and muscle mass, are important. First of all, as you mentioned, decreased mobility. right? You look around and you can see the effect that decreased mobility has on a person.
Go sit in a mall anywhere and watch people. Watch how they get out of a chair. And look, you have an injury. I understand that. Okay, look.
Yeah, we're not talking about those things.
Look at how much hip replacement we see, knee replacement we see. I mean, if you want to get into an industry, you'd want to be in the joint replacement business. But why do people lose joints? Look, again, you can have an injury.
Yeah, we're not talking about the football player who got his knee blown out or, you know.
But we are talking about the football player who now has a bad knee and becomes immobilized, and watch how fast he ages. The average guy, I remember this is years ago, and I don't know what that statistic would be today, but the average NFL football player lives lucky to live into their mid-50s. But they blow out knees, and then they're not active anymore. They're big to start off with, and they get the muscles go down fast, and their quality of life, and they age, and boom, they die of heart attack or whatever, right?
And another thing that we see, and we can do an episode on this one time, and maybe we'll make a note to do an episode on this down the road, which is balance. That's such a big issue today. Balance could be anything from insulin resistance symptoms to a whole whack of things. But the fact of the matter is, when somebody has poor balance, they have weak muscles. That's just one of the side effects of having, weakened, decreased muscles is poor balance, right? So what happens is we age, we lose muscle mass, and we all of a sudden our balance also goes down. And you think about the physiological effect of weaker muscles and how they don't stabilize a joint properly, and how our ankle mortise joints are not stabilizing as well because the muscles and tendons that go into it are not doing their job properly. And it all makes sense why all of a sudden our balance is not quite is what it used to be. So if somebody is losing muscle mass, they have less balance, right? They're less mobile, and when they do move around, they have less balance. And then also, obviously, as you mentioned, sarcopenia leads to the increased risk of osteoarthritis because the body runs on a principle, and we've seen it forever. If you don't use it, you lose it, right? The body, you don't use it, you lose it. Mm-hmm. So if you're not using it, you're losing it. So what happens is, as somebody starts to become more and more immobile, they lose muscle mass, they lose their balance, they stop moving even more, and then that leads to osteoarthritis. That increases their risk of falls, and then their quality of life goes down. Yeah. Sarcopenia is a big deal. It is a big deal. And what's interesting is, and this is really what's interesting, is they found that after the age of around 25, we start to lose a percentage of our muscle fibers every year, right? So like 25 is kind of that peak. It's not like that for everybody, but as a rule of thumb, around that 25 age, as we go down, we start to lose a little bit. So you can imagine you have to work that much harder to maintain or even to gain after, right? So that's important, first of all. But what's interesting is the studies have found, and we've talked about this before, studies have found that when you age and you start to lose muscle, you have two different types of muscle fibers, right? You have those type 1 or those slow twitch fibers, and those slow twitch fibers, they're the low force, low speed, low power muscle fibers. Then you have type 2 or fast twitch, and they're the force, the explosive, the speed type of muscle fibers. So you have really two types of them. Yeah. And when you're aging, you're losing those fast twitch, those force, those power, those speed. Those are the ones that we lose as we age. So that has a big impact on how we age. Now, what I want to do is talk about a study that we kind of talked about before off air, and was this comprehensive study done where they had 8,000 people in the study, and what they did is they followed them for almost 18 years. So here you have 8,000 people. They followed them for about 18 years. And what they did is they assessed the muscle strength and the cardiorespiratory fitness of these people, and they tracked it as they aged. All right, so that's what they did. So they tested them in a whole bunch of different ways, and this is what they found out. They found out that if a person is classified in the lowest third, right? So you got 8,000 people. They followed them for 18 years. They tested them, all these fitness strength testing. The ones that were in the lower third for strength were 50% more likely to die from anything. All-cause mortality, right? Die from anything, even tripping on their shoelaces and dying. All-cause mortality. They were 50% more likely to die than an individual who was in the upper third. So strength.
So sarcopenia is very important, isn't it?
Strength matters. Muscle mass matters. Yeah. So if you want to increase your chance of living longer, or you want to decrease your chance of dying of anything, muscle mass matters. Absolutely matters, right? I mean so muscle strength. And what's really interesting in this study as well, they found a few other things. Not only does it prevent or it increases your chance of living longer, or decreases your chance of dying from anything, it also had the same effect on cancer. They found, so what they're saying is muscle strength has a protective effect even against cancer. You're less likely to get cancer with stronger, more muscle mass, better cardiorespiratory, the whole 9 yards. It's interesting.
Yeah.
So now we're not just
back, right? It comes back to what we were talking about earlier, is that when you go downhill, right, in a very simple way, you're going downhill, your insulin resistance is going up. And if insulin resistance is going up, all your bad markers in your body, like your inflammation markers, your free radical markers and all that, are going down. And are going, those markers are going up with it, And so what happens? Your body, now you're susceptible to cancer, cardiovascular. Well, the things that kill you, diabetes.
Those are the things that's right. Not only do they affect your quality of life, they kill you, right? So if you're listening and you're like, okay,
what's that mean?
What does that mean, right?
Yeah.
Well, first of all, what the study and other studies have found, and that was a comprehensive study, one of the best on this subject, found that this physical strength, or the process of developing strength, is linked to healthy aging. It is very, very difficult. You have to be a genetic freak. If you want to age healthy, strength or the development of strength is important.
Yeah.
That's the bottom line. So that is the bottom line with that. So now, it brings us into what we wanted to talk with the whole time, which is, where does protein come in? If you want a healthy age, you better be exercising, developing strength, right? Weight training. We talk about that all the time. Makes your muscles more sensitive to insulin. It's one of the, there's nothing like lifting weights. And we're not talking about becoming the next, Arnold champion. That's not what we're talking about here. We're talking about just practical lifting weights, right? So you have to lift weights, and you better be getting enough protein.
Yeah. Protein.
Protein matters.
Protein matters. Less carbs.
Now, the current RDA, and this is what they've studied, and they looked at this. The current RDA is roughly, well, it isn't roughly, it's 0.8 grams per kilogram per day. So about 0.8 grams of protein per kilogram per day. But what they're finding out, and this is interesting, and this is what we talked about before we came on the air as well. What they're finding out is that there's something as we age called anabolic resistance, meaning anabolic is just a fancy word for growing, right? So as we age and the older we get, our muscles, it takes more to make them grow, right? We just don't grow as we age, obviously. Yep. So and the same applies to protein. As we age, we just don't, studies have shown this, that we don't utilize protein the same way that we used to. So the research shows that you actually need more as we age.
Yeah. Doesn't that sound like the Martin Clinic?
So, and it is, and it's funny. If you want to age healthy, so basically from a practical standpoint, the RDA is low. And most people don't even get the RDA of protein. They don't get it. They get less than, they get 60 grams if they're lucky of protein a day. Then their muscles are eating away. Their muscles are wasting away. They're not doing any kind of strength training. They get to a certain age and they can barely move around. They got no balance. They can't get out of a chair without falling. So, it does matter. So the bottom line for the average person who's listening is you're probably not eating enough protein. Practically, a meal should be built around protein.
And protein at every meal. Absolutely. Right?
Absolutely. What's also interesting, and this is kind of a little bit outside of the scope of this episode that we're doing here, is that they've done what they call protein overfeeding studies, where they've given people a ridiculous amount of protein above and beyond what they normally eat in a day. And they found that it had no effect on weight. It
wasn't negative.
No, so you can't.
Wasn't hard on the kidneys.
No, that's a joke. That's a fallacy, right?
Because people, I'm telling you,
it is.
The research doesn't support that. Like you talk to a dietitian or whatever, say protein.
Yeah,
just use the word.
Watch out.
Kidneys.
Yeah, watch out.
They'll think kidneys.
No.
Okay.
Do you know what causes kidney damage? Insulin resistance.
Yeah.
Insulin.
Sugar.
Yeah. I mean, anyways, you're right. I mean, that whole protein. Yeah. What about my kidneys? No, cut down on the sugar.
Shown, right? I mean, if you Google ketogenic diet and kidney disease.
Yes, they say that it can replace dialysis. Research is showing that.
So ketosis is like you're not eating any carbs, right?
No,
you're eating nothing but protein.
You're right. I mean, the whole idea. So let's just say it this way. You really can't err on the side of too much protein, right? So you're better to overeat protein than undereat protein for healthy aging. So the bottom line, if you're listening to this, you're probably not getting enough protein. If you look at your day, you count it up, you're not getting enough protein, that's for sure. So plan your meals around a protein. Protein should be the centerpiece of a meal, right? Not the side. Like, it shouldn't be the afterthought.
So if you're having fruit in the morning,
well, don't.
You know what I mean? Like a lot of people do. They think, well, that's really good for me, right? But no, you got sarcopenia in your breakfast.
Yeah, if I were to design a breakfast for sarcopenia, for poor aging, it would be the traditional diet that was big in the 90s. Remember, these were big, right? Bagel, fruit, and orange juice.
Yeah.
That's a sarcopenia diet. How to get muscle wasting
as you age.
101. Yes, that's right. So, I mean, that for sure. Yeah. Now, so bottom line, like, is there a specific goal number you should hit? Let's just say there is. But, eat more protein. Just, if you plan your meals and snacks around protein.
Okay, I was saying this to a patient today at the office. I said, can I ask you a question? Just because I saw lots of insulin resistance when I tested her. I said, can I ask you something? What do you feel better when you eat? Steak or a piece of bread? And she said, well, I actually crave steak. I said, yeah, because your body's screaming at you to start getting more protein in your diet and healthy fat. And, you need that. So, you know what I mean? I said, look, why don't you listen to your body? It'll tell you. You start eating clean, what I call clean. Like start eating lower carbs, not no carbs, but lower carbs, higher fat, higher protein like we like. You'll feel better. And then you'll see, like, the results are astounding. You get your insulin resistance down and everybody and their dog gets better. Everybody. They just get better. Everything gets better. Right? Their blood work gets better even. I said, well, prove it to your doctor.
That is...
Your triglycerides will go right down.
Yes.
Your insulin resistance will go down. Your blood sugar is going to go down. Your blood pressure is going to go down. Everything's going to go down.
And the funny thing is that same person the doctor will say, well, what are you doing? They're like, well, I'm eating a lot more protein and fat. They're like, that's going to kill you. Even though they just read that every marker that points to early death.
Kidneys.
Right?
You're gonna get
every marker that
disease.
points to early death is better, but they're saying don't do that. It's dangerous. So it is. I mean, it is. It's it is ironic, right? Yeah. So, but again, moral of the story is age well, two things. I mean, there's more to it than that, but for the purpose of this episode, an active life, right? Lifting weights, an active life, and make sure you get enough protein. Yeah, that pretty much sums it up. Yeah. All right. Well, we want to thank you for listening to this episode. If you have any questions on it, you can email us at info@martinclinic.com. Also, usually Thursdays and Fridays, we always do a Facebook Live event. And, you can ask us questions live. We have fun doing it. We get a lot of great feedback on that. A lot of people watching our videos. So if if you're not following us on Facebook, then go ahead and just like our page, and then you'll get a notification whenever we go live. So, that's one way. Also, if you're listening listening to this on iTunes, we would really appreciate if you would leave us an honest review on iTunes, because that definitely helps the show get distributed better. So again, we want to thank you for listening, and be sure to tune in again next week. You've been listening to the Martin Clinic Wellness Podcast, brought to you by martinclinic.com. We are truly thankful that you took the time out of your busy day to listen. Talk soon.